We have someone with us today that thinks that not enough is being done about AIDS, that thinks that the issue's been politicized, and that actually there are many things that could be done about AIDS that are being avoided for political reasons, and that the disease will be in effect spreading because of politics. Today we have with us Kirk Kidwell. And Kirk, why do you believe this?
Well, I think that the problem with AIDS is not that we don't have the right medical or scientific information. Public health officials, medical authorities in the United States knew enough about this disease by mid-1983 that they could begin to put into practice certain public health measures that would have contained the spread of the disease among homosexuals and prevented its spread into the general heterosexual population over time.
And the reason
they didn't do that wasn't because they didn't know enough. They knew who was at risk for the disease. They knew what types of behaviors transmitted it. They knew it was a sexually transmitted disease, etc., etc. But they didn't take the actions that should have been taken and begun to have been taken in 1983 because of the politics of AIDS, not because of the medicine of AIDS.
Why is it political? Why is it political?
Well, it's political because it involves, 2/3 of the cases involve homosexual men. And the homosexual movement has viewed AIDS as a threat to its survivability and to its ability to achieve its political agenda in this nation.
Before you go any further, Kirk, I did want to just introduce you. I wanted to get the topic out on top of the table, but I did want to introduce you. Kirk has written frequently on the AIDS epidemic and the homosexual movement, and for the past 2 years he's been researching and writing a book on the subject. He's attended numerous conferences on AIDS, including the 3rd International Conference in Washington, D.C., and has covered the Gay and Lesbian March on Washington. And he is the author of a report entitled The Truth About AIDS. So you've been looking at this, Kirk, for some time. And tell me, how did you first get interested in the topic?
Well, ever since this disease was first reported in the early 1980s, I, like a lot of other Americans, kind of followed it in the news media, on the network news, and the weekly news magazines, the newspapers, etc., etc. But as time began to go by, and I'd say starting in 1985, I began to be concerned that AIDS was not being dealt with as it should have been at that time. It seemed to me that the politics of AIDS was overriding the medical and scientific understanding of the disease. So I began to look into it somewhat, and the more I learned, the more alarmed I became. And it's now been about 2.5 or so years since I began to research a book, which I'm in the process of writing right now.
Tell me, let's take some disease, a common disease that is being treated more seriously than AIDS, differently, and in a way that you think AIDS should be treated. Can you give an example?
Well, I think AIDS should be treated like other sexually transmitted diseases, syphilis or gonorrhea, chlamydia, cancroid. You know, there's a lot of different diseases that are
how is the treatment or how is the seriousness between the two differentiated? Why is AIDS, in what way is AIDS not being treated with as seriously?
Well, it's not being treated the same, again, because of the politics of it. Because homosexuals
But in what way is it not being treated the same, I guess is my question.
Okay, it's not being treated the same in that we are not implementing the same public health control measures that we use in an attempt to control syphilis and gonorrhea, for example.
Can you give an example
Sure.
of these?
There's basically 4 elements of a public health program to prevent and control a sexually transmitted disease epidemic. The first thing that needs to be done is to implement a system of testing for this disease. We have to know who's infected out there with this disease. That's very basic to this. In terms of AIDS,
so identifying, obviously, the population you're
testing,
dealing with.
Yes. In terms of AIDS, we need to begin to do routine testing by doctors and physicians and hospitals when it's medically indicated. We need to be testing women who are about to become pregnant, who plan to become pregnant, people who are planning to be married. We should be testing in a broad range of areas. How mandatory that is, I'm not sure at this point.
Are some of these tests being done on other diseases but not on AIDS today?
Well, it's not the same test, but we do, in many states, I think it's 16 right now, a Wasserman blood test is required to detect syphilis before you can get a marriage license. And testing is done routinely by physicians, sexually transmitted disease clinics and hospitals, etc.,
But
when it's medically indicated.
are you saying these same states, for instance, many of them do not at
They're
the same
not
time
testing.
test for AIDS?
No.
They're testing for other diseases but
That's
not
correct.
AIDS?
Yes.
And you're saying that's being prevented for political considerations?
For the political reasons. Yes.
Okay. Well, that's very interesting. I'm sure a lot of people don't know that fact. Tell
I
us
think let me
tell us
go
other
on
ways.
and list the several other things that should be done, because testing is just the first stage. If all we did is test, it wouldn't accomplish that much. We need to do something else, and that's known as infection reporting. And this is done for a wide range of communicable diseases, not only venereal diseases like syphilis and gonorrhea, but other diseases like tuberculosis and cholera or yellow fever and on and on. And the way this works is that when a person is found to be infected, they're reported to the local health department by the physician who diagnoses that case of whatever the communicable disease is. Now, right now we report cases of what the Centers for Disease Control defines as a case of AIDS. But we are not reporting, in most states, and in California in particular, we are not reporting cases of infection with the virus. And the period between when a person is infected with the virus and when they develop CDC-defined AIDS could be as long as 10 years. So in a sense, we're 10 years behind this epidemic because we're concentrating on the end stages of this viral disease. We need to begin reporting the infection with the virus early on to local health departments.
Okay. Let me ask you, this is a question I think that's being asked, if not weekly, almost daily. How severe is the AIDS epidemic in this country?
Well, it's very severe. Right now we have had over 52,000 cases of AIDS reported in the United States with close to 30,000 deaths. By 1991, the Public Health Services projected those to increase to, in that year we would have 74,000 new cases of AIDS reported in that year alone.
Now, would this be, how many of these in the future are new infections, and how many are infections that are potentially already there?
Well, a lot of the ones over the next 5 or 6 years are going to be people who are already infected, because the average latency period for this disease is 12 years. There are some people who develop it rapidly within 2, 3, 4 years. There are others that it may take 10, 12, 15 years before the disease
You said the
manifests.
average is 12 years. That means that there are some that could be 20.
Yes, that's correct.
So do monogamous couples need to be concerned?
Well, if a person has been chaste before they were married, and they marry someone that they know is not infected, and they know that they're not infected, then no, they don't need to worry about it. In the case of a person who was married before AIDS ever was around, if they've been faithful within that marriage, then no, they don't need to worry about it, unless through some fluke they get it as a result of a blood transfusion, which doesn't happen very often anymore. But that doesn't mean that they don't need to be concerned about it. For one thing, AIDS is going to cause the death of millions of Americans in the decade to come. And so, out of simple concern for human life, people should be concerned about AIDS. But there are a lot of other reasons. AIDS impacts on just every aspect of American society, everything people are concerned
I'd like to
about.
get into some of those impacts, but let me ask about the people are always concerned about how they can pick up the disease from casual, either casual, you hear the term casual contact, but what about there is some concern, let's say someone carrying AIDS was working in a restaurant, for instance, and they cut themselves and their blood got into food. Could that potentially transmit the disease?
Well, we don't live in a risk-free world. There's always the potential for the unheard of or unthinkable to occur. However, I don't think that healthcare or food service workers who are infected with this virus pose a grave risk of transmission to patrons of restaurants. For one thing, if someone cut their hand and bled into the food, the restaurant is most likely not going to serve that food.
Sure.
Now, if the person hid it and covered it up, that would be a concern. I would say, though, that there is a greater risk of acquiring other diseases like hepatitis A, which can